Good day, ladies and gentlemen. I'm Mike Mochel from the faculty at Defense Acquisition University. I want to thank you for this opportunity to come in and talk with you about some of the issues that you're experiencing here within the Defense Health Agency. Here's our agenda for today. I'm just going to start with a broad overview, a little bit of a summary of what we'll be talking about. Then I want to get into the topical discussions on the topics that you've asked us about, the issues that you've brought up to us that you'd like to discuss. And then at the end, I'm going to give you a series of references that I used in putting this presentation together so that you can dig in deeper if you wish after I've left here. By way of an overview, just a reminder, we're here at the DHA up in Falls Church, Virginia, and talking today. And here are the topics that you brought up to us. You asked us about current practices in managed care. I want to talk a little bit about those. When you talked about stakeholder management, you asked about doing that, and that really divides into two different topic areas. One is identifying stakeholders, and the other is engaging with those stakeholders once they're identified. And then, of course, in the health profession, we all know that stress is a huge issue for you folks, and so managing stress is one of the topics that you want to talk about. And then we'll wrap it up with a brief conclusion. So let's jump right in to these current practices in managed care. And I start each one of these topic areas with a little introduction from sacred scripture, because I think that especially in the medical profession, there's a big tie-in. There's a spiritual side to health that I think impacts us all here. And here you can see this quote from Matthew. We all know that we don't need a doctor when we're well, right? When we're healthy. We need one when we're sick. And if we are going to be coming to see a doctor when we're sick, then we need them to provide us really good care. One of the ways that we are looking at nowadays in doing that is this thing called a patient-reported outcome measures. It's a current hot topic in managed care. It's a current best practice that people are looking at. PROMs are being used throughout, and basically what PROMs are, they are metrics that are gathered from the patient's perspective. So asking the patients what they think of the care they're getting with and involving them in the decision making so that the medical staff and the patients work together to make the best possible decisions about patient care. I think that's something that you could implement quite readily and quite easily within your VA medical centers and within your military treatment facilities that would help you build rapport with the patients and lead to better patient outcomes. Another hot topic today is this idea of the Comprehensive Primary Care Plus, or CPC Plus. This is an initiative implemented by the Centers for Medicare and Medicaid Systems, CMS, and it's really the first time that the medical community, and especially on the government side, has tried to engage with vendors to help them get involved in the IT world, in the information technology world, and having access to certain things that they can help and help the government and medical system with better care and providing better care just because they have better access. It has faced challenges. I'll be honest about that. But by the same token, they have made inroads in establishing a partnership with the various vendors, the various contractors out there that provide goods and services for the government medical community. And it is a significant step forward, one that I would encourage DHA to participate in, to get involved with that, and I can help you get more information on that and tell you where to look for that. The last trend I want to talk today takes us from a high-tech, the world of information technology, down to very low-tech, and that is the idea of using checklists. It's remarkable how efficient checklists can help us be. I'm an old missileer. I came out of the missile capsule where checklists were our world. It was basically read a step, do a step, right, and survive in the world of missiles. Well, we're finding that checklists, they can provide distraction sometimes, but they do help clinicians collect, especially things like social determinants of health data, SDOH data, right? They help them collect that data more efficiently, more effectively, and a result of that is that we start to see a building of trust between the clinicians, between the medical staff, and the patients. And we know that trust helps with patient care. A trusting relationship between patient and provider is key in those types of areas. So those are three of the top current current best practices in managed care that I think DHA could benefit from by jumping in, and they're pretty easy to implement. The next thing you asked us about was managing stakeholders. And we divided that into two sections here. Before you can manage stakeholders, you got to identify them. And as Proverbs tells us, in an abundance of counselors, there's safety, right? And so the more counselors you have, the more stakeholders you identify and engage with, the better off you're going to be in the long run, because they are sources of information. They may be sources to help you get things done and things of that nature. But you have to start by identifying them. And before you can do that, you have to identify or define what a stakeholder is. And I want to just go read to you from an article, from a 2023 article that defines stakeholders. I think that it's one that applies in this situation. And it says a stakeholder group is one that either uses guideline recommendations to support health and healthcare-related decisions, or is affected by those decisions. So that could be a lot of different people. That could be a lot of different organizations, a lot of different groups, both within a particular medical treatment facility, military treatment facility, within DHA as an agency, within the Office of Secretary of Defense, or out in the general public. It could be a lot of different peoples that are defining that. So let's look at some of the people that can be in that rather expensive list. People like the patients themselves. The patients are certainly recognizable as stakeholders, and their families, right? Their families, and especially when those families have caregivers within those families. So if the patient is going to be receiving extended care at home, and the family is going to be involved in that. Obviously, the healthcare professionals themselves are stakeholders in this whole thing, but people like ward and unit managers come into play in the stakeholder game. Service or case managers, as you go through and as patients evolve from in-hospital care to home care, or maybe a rehabilitation facility, those types of places. So those service or case managers come into play. Regulatory investigators. We all have the inspectors, right, that come and visit us. So they are stakeholders in the organization. Policymakers, the people that are they're making and designing the policies, whether at the Defense Department level, over in Congress, maybe within the Centers for Disease Control, all of those organizations that come into play in making policy for medical care would be stakeholders in this. Other service providers and the civilian community. So maybe you work with hospitals in the local area, or maybe you're working with other government agencies like Department of Health and Human Services. All of those are out there as stakeholders. It may change. The stakeholder group may change depending on what circumstances you're into, and especially in some circumstances. And I refer you to one example where, in the case of organ donations and transplants, there were very specific policymakers involved in those who are stakeholders, and they also see society at large as a stakeholder in that, because the donations of organs may come from anywhere, right? It may come from any part of the populace out there. Now, we at DAU have a tool that we like to offer to organizations to use to help design or help identify their stakeholders. And what I would recommend is sitting down as a leadership team, after this session and working through this. But it's a series of concentric rings, kind of looks like a target. And in the middle, the closest stakeholders are the team that's immediately involved. That should be clear. The next step out there is the organization that a team is a part of. Beyond that, then, is the agency, and then all the external stakeholders. And if you sit down and think through each of those four rings, you tend to fill this target up with a significant number of stakeholders. The other thing it does is it gives you a tool that you can always go back to when you come up with, identify a new stakeholder, and you can add them in. So I would recommend getting together as a leadership team following this session and working on this tool. I can provide you the tool. I'm also happy to help out with that. The other side of stakeholder management is engaging with the stakeholders, getting them involved, working with them. And as it says down there, just like Acts says, God shows no partiality among people. Neither should we when we're dealing with the stakeholders. We should treat them all as important to the process. Some are more important than others, certainly, but we should make sure that we engage with all of them and treat them all without partiality as we go through. So let's look at some ways that have been tried recently of doing that. Some organizations have implemented this idea of a general summit, where they just put out basically a call to all of their stakeholders, bring them all together in a conference facility, and talk and have a discussion. Let them know what's going on in the field. Let them know what kind of help they need from them. And so just bringing them all together about that. One major benefit of such a summit is the ability to collaborate and create collaboration between groups that might not normally interact with each other. So it's a wonderful opportunity to bring disparate people together to collaborate in a new and different way. A second engagement strategy is for targeted groups. So maybe you are working, you might want to work with a set of groups that are all deal with a common situation. For example, maybe you have groups that are geographically separated, but they all are specializing in care of older adults, for example, let's say, or adolescents or whatever. So having those targeted groups come together, or going to them and sitting down and talking with those groups individually and then bringing the results together is a way of engaging with your stakeholders. And then finally is dealing with a very narrowly focused specific group. Stroke rehabilitation comes to mind. That is a very specific group of folks that deal with it in a very specialized area, and sometimes just sitting down with them and getting to talk to them and working with all of the stakeholders involved in that area lets you focus on a particular problem, but gain those insights from as broad a spectrum of stakeholders as possible. So all three of those things are techniques that I would encourage DHA to start applying to begin the process of engaging with their stakeholders. And in applying those, you may find others that you decide to try that work well for you. Okay, so the last then topic that you wish to talk about was managing stress. We know that medicine is a stressful environment, but it's also clear from Scripture, that God wants us to let Him help us with that, right? He wants us to put our cares on Him. He wants us to turn to Him to help manage that stress. And as much as we can try to do that, sometimes it proves difficult to do. Sometimes we find that the stress just keeps building up within us, and especially we think back to the COVID-19 pandemic, right? When we go through something like that, we find that stresses start to build up, and what do we do with those? And I know you have talked about the increasing levels of stress that you're seeing within DHA. In those cases, we need to find ways to help our people deal with it. If we're going to do that, the first thing we need to do is be able to measure it, to know it's out there. Now, this is one technique for doing that. There's one new questionnaire that's out there to do that. This one is aimed specifically at nurses, and it is called the Saltogenic Survey on Sustainable Working Life for Nurses. So yes, it's very uniquely focused on nurses, but it's an example of what can be done to help you survey your folks and determine where stress levels are and see where there might be some work that needs to be done. Once you have done that, once you have determined that there is stress out there, there are some mechanisms. One such mechanism that came out that we found during the COVID pandemic was just simply people who were in a common situation working together, getting together and talking about it. talking about what they were experiencing, finding support from those conversations with each other, and realizing that we're all in this together, we're experiencing the same kinds of things, we're all dealing with this stress, and that can help alleviate some of the stress. That can help manage some of the stress. So just coping with it together. And then another way that has been found to be very effective recently are these implementation of wellness programs. And leadership needs to be proactive in doing these things in 3 different ways. They need to be proactive in identifying and implementing such a program in their organization. They need to be proactive in granting permission for people to participate in those programs, even during working hours. At DAU, we've had a policy for years where we have a little internal gym. People can take off and take an hour at lunch or take an hour of free time and go down to the gym, work out, relieve some of that stress. But it's done during the workday. It shouldn't always have to be done after they go home at night. And then finally, leaders can be proactive in serving as the role models for those programs. Get out there yourselves as the leadership team and let people see that you're making use of those wellness centers. That encourages them to do it. That says it's okay to go out and do these exercises. Okay, and I would recommend if you have not implementing those programs out there for your staffs and then participating in them yourselves. So, in conclusion, we've talked about the issues you brought before us. The issue of what's going on in the world of managed care nowadays. What do we do about managing our stakeholders and looking at both how do we identify them and how do we engage with them, and then finally how do we look at stress? I've provided some recommendations in each of those areas that you can take and think about and work through as implementing them as the way you would want to. And as always, DAU stands ready to support. We have a robust consulting program that we are more than happy to work with you on implementing any of these recommendations that you want to implement. And I'll just close by rapidly flipping through my pages of references. As I said earlier, these are all references that you can use, you can look up and use if you want to dig deeper into any of these. And as always, if you have any specific questions on any of these references or any other aspects of this, I stand ready to help. And I thank you for your time.